We started with a really strong leadership vision. So our leadership from our chief operating officer, chief medical officer, even our chief executive officer really made this their priority. And that got everyone excited, it got everyone on board, and it was things that everyone wanted to work on already. So this really just empowered our directors and our managers and then our frontline staff to start working on this in a team collaborative effort. It's everyone has their hand in this. Has become our goal is to really transform our operations to support patient flow. We're working on every aspect, starting with the ED. So are we getting the right patients into the ED to begin with? Then we're focusing on, once we have the patients, we know that they should be admitted, how do we get them to the units faster? How do we get that handoff better and more efficient? And then we're looking at our patient placement process. So are we asking the right questions at our bed meetings? Are we really talking about demand? Are we talking about capacity? Are we doing that every day and consistently and really asking those right questions, talking about our barriers? Then we are looking at our interdisciplinary round process, making sure that our physicians, our nurses, our case managers, our patients are all talking every single day so the patient knows the plan of care. We're talking about our escalation process. Do we have we know we have something informal, but do we have something documented so that a nurse can escalate it to her charge nurse, to the unit director, if we're trying to get a patient discharged? And we're looking at all of our data and our IT systems to make sure that that is supporting all of our operational goals. So we meet weekly, that our leadership group and our directors meet weekly so that anytime a barrier comes up, they're right there to start working on it immediately. Our COO comes to our daily bed meetings, so he is there to hear firsthand what the staff nurse is saying, and that keeps it going. That's how we're not held up by, bogged down by process. We really have all the right people at the table meeting frequently to address the different issues that come up. Yeah, so we've seen month over month since we've kicked this off, anywhere from an additional 50 to 100 discharges per month. So we're, without having to build new beds, which is what, $2 million plus per bed, we've seen, an additional, on an annual basis, about 600 new patients that we wouldn't have seen if we didn't get this group together. We're really hoping to build a care traffic control center, so an operations center that proactively manages our patient flow. So imagine our patient placement, our transfer center, our care management team, our EVS, our transport, our facilities team, all sitting under one house in one room, so that they can all talk together, work, hey, this patient's being discharged, let's get this room cleaned. The communication is there and broken down. And so it's really about a proactive planning. I think what's going to be really cool about this is it's going to be more than just patient placement and flow. We're also able to do some quality monitoring immediately. So it's more than just the operations. It's also looking at quality. And we'd like to bring in some real-time patient satisfaction tools as well so that we can address some patient satisfaction and service recovery as well.